This webcast was created as part of the Time to Take a Fresh Look initiative by Carl Zeiss in the UK. Carl Zeiss Meditech is a global company, and laser refractive surgery is an established and widespread procedure practiced in the 21st century. It requires specialists with sophisticated skills demanding knowledge of physics, laser tissue interaction, surgical application and wound healing. Today we will follow a patient through her consultation and measurement process and witness her laser vision correction surgery. Worldwide, around 2.5 million refractive procedures are performed annually. Through wavefront analysis and accomplished treatment planning, excellent outcomes can be achieved. Carl Zeiss Meditech integrates wavefront analysis in their treatment planning platform, the CRS Master. The CRS Master allows customized wavefront treatment by taking into account individually selected aberrations of benefit to each patient.
Bella? Hi, Dan Reinstein.
Hi, Dan.
Good to meet you.
Our expert surgeon today is Professor Dan Reinstein, who operates out of the London Vision Clinic. He is one of the most experienced surgeons and has performed over 8,000 procedures.
Okay, come this way.
Thanks.
The synergy of Carl Zeiss Meditech's innovative and superbly engineered instruments, together with an experienced and expert surgeon, is only part of the successful outcome. For the patient is unique, and understanding his or her vision-related problems is essential if laser surgery is also to be a successful experience.
Right, so you're a copywriter.
Yeah.
Today we will demonstrate for those seeking information and a clear understanding of customized refractive laser surgery for vision correction, the route to unsurpassed outcomes and delighted patients. Customization begins with the doctor and the patient discussing the patient's past history, their vision issues and available options. Good communication is essential to fully understand the patient's needs and expectations.
So a couple of years. Any operations?
Bella is a typical patient. Bella does not wish to wear spectacles, finds contact lenses are uncomfortable, and she wants to enjoy a full and active life. She is concerned about complications but wants to know if she can have laser surgery.
Okay. Right. Well, basically, right. This here today is not actually an eye exam. It's a screening where I'm going to look in depth at the aspects of your eyes and of your vision to see if they fit within the safety parameters of doing vision correction surgery. Okay?
Age, general and specific health issues, pregnancy, eye disease and eye geometry all affect the patient's suitability for treatment, together with a degree of correction required.
7 or
Can't really see it. Maybe see the one. 9 is better.
and how far down can you read there?
Care and accuracy of measurements reduce the risk of complications, as do the instruments used for the surgery itself. There are several important factors that limit the range of surgical correction. The laser is capable of treating a wide range of errors, but it is only with the detailed knowledge of the patient's eye that optimal and safe treatment can be planned. To obtain the detailed knowledge, we verify the patient's prescription, their pupils' diameters under dark-adapted conditions to ensure the laser correction covers these diameters, and their corneal thickness is measured to determine if laser correction is possible. This may determine which type of treatment to perform, LASIK, LASEK or PRK.
You have moderate myopia, around -475, and essentially the parameters are all within range of what we would call a standard procedure. Straight ahead. Straight ahead. Yeah.
Typically, Professor Reinstein performs 2 consultations prior to the day of surgery. During the second consultation, detailed eye measurements are recorded and the treatment planned. To maximize the safety of refractive surgery and to provide the surgeon with the most material to optimize the outcome, the patient's topography is verified, including the posterior corneal shape. This is checked for corneal scarring and early signs of keratoconus, which would preclude surgery.
Okay, great. Now can you sit back? Swing your chair over to this side.
Important preoperative assessment includes binocular determination of pupil size in controlled lighting conditions.
Okay. So just look inside there. You should be able to see
High-resolution wavefront aberrometry can measure the most highly aberrated cornea. As integrated into the CRS master, control of the customization process is improved. Manifest patient refraction, scotopic pupil size, optical zone control, selection of individual Zernike coefficients for treatment, corneal shape data for fluence compensation control, and corneal and flap thickness to ensure maximum safety are all evaluated.
That's excellent. Okay, great. Let me show you how it is that we go now and calculate your treatment.
Armed with the entire gamut of tests and examination findings, the surgeon inputs the data into the CRS master and develops a completely customized and optimum composite ablation profile, the treatment plan.
We're going to take all four, and we're going to average them. And what this machine...
Patient's prescription, pupil diameter, pachymetry and K readings are all entered into the planning computer. The CRS master also recognizes the specifications of the microkeratome. These values are used in calculating the parameters in order to perform safe, accurate surgery. But the surgeon remains in control and can vary any parameter according to the patient's individual characteristics.
And the CRS master allows us to control...
We have the unique option of treating with or without wavefront correction, and which aberrations to include in the plan.
Electronic sign-off here.
Bella's treatment will include wavefront aberrometry in addition to so-called routine sphere and cylinder correction.
Okay, so I'm now going to import the patient's data into the laser. Okay, so we'll just put this here. It automatically detects the disc and imports that.
Before treatment, the treatment plan is uploaded to the MEL80 computer and verified on screen. The unique selected wave setting enables a bespoke procedure to be configured for each patient.
Diameter 11 millimeters. Then we're going to move on to the fluence test. So we line the paper, swing the CCA into place.
The CCA controls the atmosphere between patient and laser to maintain constant energy and ablation accuracy.
So I'm just going to shoot the first ablation. Check. So this is, of course, shooting at 250 hertz. And this fluence test is actually a very, very sophisticated test. The other two things...
The MEL80 calibration routine is one of the most sophisticated of any modern laser because it confirms at the point of treatment laser fluence, spot diameter and geometry, and the exact positioning of the beam steering mirrors by etching specific patterns into the test form.
One over here, because that is a micro dot of breakthrough code is exactly correct. If you look at the pattern cut, there's also a white circle here in the center.
The eye tracker provides an extremely low latency or reaction time. Using high-speed infrared video imaging at 250 Hz, we are demonstrating violent movements being tracked with complete accuracy. Alignment of the patient is made by bed movements that are preset for comfort. The patient is loaded onto the bed and with a single key press, the bed moves into position under the microscope.
Okay, that's fantastic. So if you just close your eyes for a second, I'm just going to tape this eye shut.
In preparation for surgery, anaesthetic is applied to the eye and the eyelids will be held open by the speculum.
You did really well. That was perfect. Well done. Straight. We're going to push on your eye a little bit here.
The eye is marked asymmetrically to assist accurate flap repositioning.
As you are, you're going to see this ring coming over in front of you again. Steady there.
The eye is accurately centered within the microkeratome suction ring, upon which the oscillating microkeratome blade pivots.
I'm going to start to push down very hard again. Bear with me here. 30 seconds, okay? Pressure's going to start to go up. The lights are going to start to go dim. Good. Excellent. Excellent. Lights are dim, right? Yes, keep breathing. Don't hold your breath. A little fluid here. 15 more seconds. You're doing very well. Nice and steady. You're going to feel a little bit of buzzing here. Nice and steady. That's excellent. A little buzzing. That's right. So you're doing very well. Everything's going perfect. Nice and steady. 5 more seconds. You're doing very well. Everything's going perfect. Nice and steady. We're going to take the pressure off. The lights are coming back now. Okay, you did fantastic. That was great. Well done. Everything's perfect. Okay, absolutely spot on. Keep locking up the tracker. Perfect. Nice. Everything's going to go very blurred. Keep holding there. That's great. Nice and steady. That's perfect. Excellent. And as you are looking straight, that's excellent. Steady there. Excellent. The light's going to turn red again. And we're going to go through the same process of hearing the little snapping sounds. Nice and steady. Right in the middle of the green as best as you can. That's great. Nice and steady.
The Carl Zeiss Meditech MEL 80 provides a real-time energy deviation reading during treatment. This demonstrates the stable energy delivery throughout the ablation process.
Beautiful.
30%.
Excellent. Excellent. Excellent.
50%.
Great. Well done. That's perfect.
The MEL 80 is an extremely fast scanning spot excimer laser, treating approximately 1 diopter of myopia every 4 seconds.
Almost done.
90%. 100%.
Fantastic. That's excellent. Fluid here. Keep looking straight there. That's lovely. Excellent. And again, you're going to feel a whoosh of fluid. Keep looking straight. A little cool fluid here. Nice and steady. Straight ahead. Looking straight ahead. Is that beautiful? Excellent. Straight at the green as best as you can.
The MEL 80 possesses a surgical slit lamp, enabling the surgeon to carefully inspect flap positioning and check for interface particles.
Small adjustments here. Bella, you had perfect Lasik on both sides. So just as you are there, just waiting for that to settle down. We'll put some drops on here. And the beauty of this procedure is the flap settles down and sticks down all by itself as we let it rest here for a minute or two. Okay, Bella, that's great. And so we're just going to gently take this
The
out.
exceedingly fast ablation time, coupled with an expert minimally hydrating flap repositioning process, offers patients enhanced wow effect.
At the end of the room here. Close your eyes now. That's great. Okay, we're just going to try it. Great. Okay. Open your eyes. A little blurred. You see that up there?
It is 14 minutes past 10.
After an interval, Bella is again checked at the slit lamp to ensure that the flap remains correctly positioned and seated. At high magnification, it can be seen that there is no gutter between the flap edge and the untreated periphery of the eye. The next day, Bella returned to the clinic and reported a comfortable night, and her vision was measured at 20/16. The Zeiss solution to modern, customized refractive surgery combines the highest resolution aberrometry with a CRS master controlled customization platform that provides one of the most accurate excimer laser systems in the world.